Yes, ma'am.
Good evening, all. I am Ms. Nikita Sangpar. Welcome you all to Awareness Drive on World Zoonosis Day, an emerging and re-emerging zoonotic disease of public health interest, organized by Department of Microbiology and Biotechnology of Patkar College. To better understand, let's first see what are zoonotic diseases. So, World Zoonosis Day is held every year on 6th of July. The day commemorates July 6, 1885, when Louis Pasteur successfully administered the first vaccine against rabies virus, a zoonotic disease. Theme Day raises awareness for the risk of zoonotic diseases. So, what are exactly zoonotic diseases? Zoonotic diseases are caused by harmful microorganisms like viruses, bacteria, parasites, and fungi. These microorganisms can cause many different types of illness in people and animals, ranging from mild to serious illness and sometimes even death. Animals can sometimes appear healthy even when they are carrying infections that can make people sick depending on the zoonotic diseases. So, this can be spread from animals to humans and vice versa. Approximately 150 zoonotic diseases are known to exist, and people can get zoonotic disease from contact with infected live poultry, rodents, reptiles, amphibians, insects, and other domestic and wild animals. So, zoonotic diseases are very common. For example, I have given some examples over here. Ebola, you must have heard recently, but Ebola is not a new virus. It is deadly disease with occasional outbreak that occur primarily on African continent. In 1967, it was first discovered near Ebola River, that is now Democratic River of Congo. And we do not know from where the virus comes, but based on similar viruses, we believe that the virus is animal borne with bats and non-human primates. And it can be spread through direct contact with blood or body fluids or also from tissue of animals as well. Next, we have here is avian influenza. This is also reported sporadically. Human infection are primarily acquired through direct contact with infected animals or contaminated environment. Uh, in 1976, swine flu virus, that is H1N1, caused localized outbreak in military camp in New Jersey, USA. And then in 1997, again human infection with H5N1, that is HPAI virus, reported during outbreak in poultry in Hong Kong. Then all human cases were shown to have spread directly from chickens without any transmission from person to person. But since 2003, this virus has spread from Asia to Europe and Africa and has become endemic in poultry population. In 2009, again new H1N1 outbreak in America was found, and it was pandemic because it was spreading between person to person. Then in 2013, again human infection with H7N9 virus reported first time in China. Next, we have here is plague. You must have heard about plague. It is also a zoonotic disease, and plague bacillus is naturally parasite in rodents, and infection is transmitted among them by rat fleas. This fleas acts as a vector. Plague pandemic is also known as Black Death because it is believed to have killed quarter of all humans in 14th century. Talking about Indian scenario about plague, plague reached Bombay in 1896, and it spread all over country during next few years, causing 10 million deaths by 1918, and occasional cases were reported till 1967. So no further cases were seen till 1994, but in February 2002, plague struck again, causing a short outbreak near Simla, claiming 4 lives. Next, we have is bovine tuberculosis. This human infection with Mycobacterium bovis used to be common worldwide, but now recent developed countries has been eliminated by its control in cattle. An infected cow sheds bacilli in milk, which is infectious to humans when consumed raw. So human infection can be prevented by drinking pasteurized or boiled milk. Person to person transmission is very rare in bovine tuberculosis. Then brucellosis, it is also acquired from animals directly or indirectly. Animals such as goats, sheep, cattle, buffaloes, and swine are common. sources, and in some parts of world, infection may be transmitted by dogs, camels, and yaks as well. Modes of infection is common like ingestion, contact, inhalation, or accidental inoculation. Person to person does not occur ordinarily in brucellosis. Then we have rabies. Rabies is also well known. You must have heard about this earlier. But human rabies is a dead end. Direct person to person transmission of rabies has not been recorded, but the virus is present in saliva of infected patients. Two epidemiological types exist, urban and selvatic. Urban is transmitted by domestic animals like dogs and cats, and selvatic involves wild animals. Uh, Talking about Indian scenario about rabies, it has been estimated that more than 30,000 people die of rabies in India every year, and more than 700,000 receive anti-rabies vaccine. Then about Rift Valley fever, yellow fever, and West Nile virus, MSc students will be presenting on those. Talking about salmonellosis, Salmonella gastroenteritis, more appropriately saying is enterocolitis or food poisoning. It is also generally a zoonotic disease because source of infection is animal products. So human infection results from ingestion of contaminated food. Most frequent source can be poultry, meat, milk and milk products, egg and egg products. Uh, Gastroenteritis may occur without food poisoning as well, like because due to cross infection in hospitals. Then we have hantavirus. You must have heard some news in between that China has released again has a outbreak of hantavirus in between. So hantavirus is hemorrhagic fever with renal syndrome, that is HFRS, also known as endemic or epidemic nephrosonephritis. It has various different names, but hantavirus is not a new virus. It attracted attention in early 1950s when a large number of US soldiers serving in Korea got infection. Hantavirus species are natural pathogens of rodents, and transmission can be from rodent to rodent and then rodent to human. Then next we have MERS-CoV. It is Middle East Respiratory Syndrome, respiratory disease caused by novel coronavirus, and it was first identified in Saudi Arabia in 2012. Coronavirus are a large family of viruses that can cause disease ranging from the common cold to severe acute respiratory syndrome, that is SARS. Since 2012, 27 countries have reported cases of MERS, but exact route of transmission is still unknown. Then COVID-19 again, MSc student will be presenting. When talking about G4 swine flu, you must have heard the recent news coming from China that it said that again one more new virus outbreak has been taken place. So G4 swine flu on July 2nd, 2020, recent research describes a group of H1N1 swine flu influenza virus that have the essential hallmarks of being highly adapted to infect humans and which therefore of potential to cause pandemic concern in future. And this is the reason why we should emphasize on awareness on zoonotic diseases. So now I would like to welcome our MSc students who will be giving us brief information about some well-known zoonotic diseases. So the very first pre presenter of the day is Famida Patel from MSc Microbiology, and she will be talking about Rift Valley fever.
Hello, am I audible?
Yes, yes, dear, you are audible.
Ma'am, is the screen visible?
Yes, dear, it is visible.
Okay. So, good evening to one and all. I am Miss Famida from MSc Microbiology. Would be presenting on the topic of zoonosis disease, that is Rift Valley fever. So, Rift Valley fever, this is not a very a common name which is heard in India, but it is very much common in Africa. So, talking about it, My presentation consists of the definition about what exactly is Rift Valley fever, Rift Valley fever virus, like the structure of virus, how the disease is spread through the virus since it is a viral infection, the sources, what are the factors that can cause the spread of virus, history. I have mentioned the history that have occurred from since 2000, how the outbreaks are occur in different parts, typically in sub-Saharan regions. And next is the transmission, how the transmission cycle occurs and how the entire transmission take place from animals to humans or from mosquito to humans. Next are the clinical features. Once a person or animal has contacted with a disease, what are the typical features which can be seen so that the Rift Valley fever can be identified. Next is diagnosis methods. What are the methods through which Rift Valley fever can be diagnosed? The next is treatment measures in animals as well as humans. Next are the preventive measures. How can we prevent and control the spread of this virus? And the last one is the ongoing research. What are the research that is going on with respect to this virus to stop its spread? Okay, so I'll start with the first definition. So, as far Rift Valley fever is concerned, Rift Valley is a zoonotic disease. As ma'am explained, zoonotic disease, it is spread by animals mostly, but it is originated from mosquitoes. Mosquitoes are the main source. So, it is mosquito-borne acute febrile viral disease. Acute febrile means it can cause mild fever in the infected person, and it primarily affects only animals. But if the animals infected animals comes in contact with the humans, human symptoms can be seen and humans can also be infected. Since animals are the one who are infected mostly, it leads to wide economic losses, and there are many death and abortions in terms of pregnant animals. And abortions are very common, those who are infected with this. So, talking about the virus, Rift Valley fever virus. So, this virus was first identified in the early 90s or mid 90s, I can say, and it belongs to Patkar-Varde family. This virus was first identified in Kenya. Looking at the structure of the Rift Valley fever virus, it is known that this structure is a panhandle structure which consists of three main segments, three main elements, that is L, M, and S. The L is responsible for polymerase, since the genomic constitution of this virus is negative strand, single strand RNA. So L is the polymerase. The M is responsible for glycoprotein formation, since it is envelope virus and it has presence of glycoproteins and subunit of G, N, and GC. The next one is S. S is responsible for development of nucleoproteins. Next, what are the sources of virus? So, first, this virus can be spread from fauna, that is animals residing in that area, or vectors. Vectors such as mosquitoes, typically Aedes mosquitoes, are responsible for spread of virus. So animal to animal contact with this, and vector like mosquitoes can spread this to animals, and then animals, when it comes in contact with humans, it can spread into humans. Humans can directly come in contact with mosquitoes as by mosquito bites, and the disease can be spread. Secondly, abortion. If some animal has been already been infected and abortion take place, then if human comes in contact with any of the infected organ, then humans can be infected by consumption of infected
Famida,
meat or through aerosols. If we,
Famida, sorry to
yes,
interrupt
ma'am.
you, but can you do a full slideshow?
Ma'am, it's blinking
Okay,
again
okay,
and
then fine.
again.
Continue with this. Sorry.
Ma'am, maybe
Yeah,
technical
yeah.
glitch. Uh, Continuing with the history of Rift Valley fever. So here I have mentioned the history. Rift Valley fever has been seen since 1965. The first case was in Africa. Here I have mentioned the outbreaks that have occurred since 2000. So in 2000, the Rift Valley fever outbreak had occurred in Saudi Arabia and Yemen. There were 516 cases, and Yemen reported 1087 cases. This was the maximum case that was reported in Yemen that year, and it occurred at a very high level. Followed by it in 2003, the same fever occurred in Egypt, then in Kenya, Somalia, and Tanzania. All these three places are yet at a risk of having this Rift Valley fever endemic again. Followed by Sudan, which is the second most cases reported. That are 738 cases, and it had 230 death in just 3 months of span. Followed by it, in 2008, Rift Valley fever had occurred in Madagascar, and followed in South Africa, Mauritania, and in Republic of Niger in 2016. After 2016, there are very rare cases of Rift Valley fever. However, according to the report of WHO, it says that there are many countries, typically in African sites, that are still at a risk of Rift Valley fever. Talking about India, in 1995, Rift Valley fever had occurred, but it had not spread throughout the country. It was only specified to one region. In 1995, in India, Rift Valley fever had occurred in Tamil Nadu, but the disease was not that spread, so it was not that harmful for others. The transmission of Rift Valley fever. Now, transmission takes place in two stages. In the first stage, when the Rift Valley fever, when there is average rainfall, the mosquitoes breed. The mosquitoes usually breed on stagnant water. So, if the water consists of any of the virus or viral particles, the mosquitoes breed on them. And when there is high rainfall, these mosquitoes shed their eggs, which consists of this virus. So this spread can be of two types. In the first type, if the mosquito directly infect any of the human by mosquito bite or something, the virus can spread into human and can cause disease. However, human to human spread of disease is very rare, but mosquitoes can easily spread it to human. The second cycle is the mosquito will infect any of the animals, typically lambs, sheep, or cattle, and if by slaughtering or by any other process, if the infected animal comes in contact with human, it can be spread to human, or animal to animal spread is also possible. If one animal in an entire community is infected, there are chances that other animals can also be infected through it. So the host range of mosquitoes is as follows. First, the virus can transmit through mosquitoes, and it can infect cattle, sheep, or wild ruminants, buffaloes. Humans are very susceptible to these. Also, African monkeys and domestic carnivores can also be affected by only viremia, that is occurrence of virus in blood, but it is only for some time, not for a longer time. It is just an acute disease. So here is a chart which represents the mortality rate. If Rift Valley fever, if any of these like lambs, calves, or kids or puppets comes in contact with Rift Valley fever, the mortality rate is almost 100%. But if the mortality rate is quite low in sheep, humans, or water buffaloes, since prevention is easy in them. Similarly, illness is seen, and abortion is most commonly seen in monkeys, camels, rats, and gray squirrels. And also, infection is at a high risk in tortoise, frogs, chickens, pigeons, etc. So this is the main cause of outbreak, which is just the summary of three slides we can say, in which the first, due to heavy rainfall, there is a formation of there is a stagnant water gets built, and the mosquitoes breed in that stagnant water, and through that stagnant water there is transmission of infection in humans as well as animals. Next are the clinical features. Now, once an animal or human have came in contact with that virus, we need to know what are the typical features. So, in cattle, first is anorexia. Anorexia is a symptom in which an animal does not feed by because they have the fear of that they will get obese, even if the animal is healthy and he or she is not obese, but they have the fear of being obese, so they quit on eating. So this is anorexia. And if they don't eat, the other typical feature symptom that follows is weakness and followed by diarrhea. In sheep and goat, the most common is fever and loss of appetite, which is also seen as and jaundice and weakness is also commonly seen. In humans, a transmission of disease in humans is usually takes place because of animals. There is very less chances of mosquito directly infecting the humans, but animal to human contact is very highly seen. So if any of the human comes in contact with the infected animal, usually during slaughtering or during animal giving birth, typically when veterinarians do that, so those who work at slaughterhouse, herders, farmers, and veterinarian, they are at a very high risk of infection, and the symptoms include: first, the clinical features in human is seen in two forms. One is mild form, and other is the severe form. So mild form, the symptoms are seen in 2 to 6 days. The mild forms have very less detectable syndrome, because it is a febrile disease. Fever is seen, muscle pains and joint pains and headache are the symptoms which are typically seen if an infected person has mild RVF. In severe forms, there are three main peculiar diseases which are seen. First is ocular, that is eye disease, because the eyesight gets lower. Second is meningoencephalitis, which is a brain disease which causes brain tumors ultimately, and hemorrhagic fever, which is seen in very less patients. So here is the clinical features that are seen in humans. Those at the left, those at the right are the mild diseases such as headache, neck pain, muscle pain. These are mild diseases that are usually seen. However, at higher risk, there are vision disorders, which are ocular diseases. Jaundice can usually occur between day 2 to 21. Hepatitis is also seen, and in some rare cases, bleeding is also seen between 2 to 14 days. Next is diagnosis. Now, how this RVF is diagnosed in humans. So there is no specific diagnosis method which is usually seen. Only in some laboratories this diagnosis is seen. So diagnosis is by the three tests which is given. First is reverse transcriptase polymerase chain reaction, that is RT-PCR. Since RNA is the genomic material of the virus, RT-PCR can be used for diagnosis. Second, it is seen that when an individual is infected by RVF virus, the antibody titer raises. Usually, IgG and IgM antibody raises to a very high level during the peak time of infection. So, the detection of high level of IgG and IgM can be seen by enzyme-linked immunosorbent assay, that is ELISA test. Usually, sandwich ELISA is performed. Third, if the animals are infected and we need to diagnose the disease in animals, virus isolation can be seen by cell culture. Like viruses can be isolated from the infected organ, and cell culture methods can be used so that the virus and can be detected for further use. Next is the treatment. Treatment is different in terms of animals as well as humans. In terms of animals, vaccination is the most important key. Vaccination is required. If the animals are pre-vaccinated, there is very less chance that the disease will be spread. So So the pictorial representation is the Rift vax, which was the first vaccine developed for cattle, so that the Rift virus fever can be its transmission can be stopped. So vaccination is the first method. Second, only one dose of vaccination is required. Thirdly, the mosquito spread should be stopped. Usually, insecticides can be used so that the animals are not infected with such virus easily, and the transmission can be halted. Treatment in humans. Since RVF is not that common disease in humans, there is no specified vaccine. There were reports that live attenuated vaccines have been developed for a treatment of this. However, it is not licensed. So RVF vaccine for humans, it is not yet developed, but it is still under development. And usually doctors recommend that typically antibiotic doses are enough. The patients get cured if intensive support and care is given to the patient. How can the spread of virus be prevented, and how the disease can be controlled? So speaking about animals, vaccination is the key. If the animals are vaccinated, the disease can be prevented. Second, if the people find that such animal is showing any of the symptoms of the disease, they should be notified immediately so that precautions can be taken at an earlier scale rather than it's after it is spread. Third is application of safe insecticides so that there is no stagnant water and there is no spread. The spread can be halted since the mosquitoes cannot infect. And if any of the infected animal is dead or aborted, there should be rapid burial of the dead body so that the virus do not spread from dead body to other individuals. In the vector, that is mosquito, typically Aedes mosquito, there should be removal of stagnant water and use of insecticides so that the water channels and garden should be cleaned regularly, and should be spread by insecticides so that the spread of mosquitoes can be stopped. In humans, typically the prevention measures include sleeping indoors, because it usually occurs in villages where people often sleep outside and they are very prone to mosquito-borne diseases. Using of bed nets, mosquito repellents, and applying the sprays on objects so that the disease can be prevented. Talking about the ongoing research, now there are two types of ongoing research. First is vaccine development and second is chemotherapeutic research. In vaccine development, there have currently many strategies which have been employed. As we know that negative strand RNA is the genomic material, so genetically engineered strains are usually in test, and also there are many of the efforts which are made to make a live attenuated vaccine. For this, there are also gene gun technique is used, gene gun immunization, in which gold or silver nanoparticles are used, through which the vaccine is directly inculcated into humans or into the body of the patient. So these are used using the structural proteins such as G1 and G2, which are the glycoproteins present. So these are, and neutralizing antibodies titers have been shown with G1 and G2. These are the techniques which are currently being employed in experimental animals, and have been successful on mice. However, there are still some chances in which there are clinical signs which are of infection are seen in mice. Therefore, it is not fully approved. However, research is still going on in this field. Next, talking about the chemotherapy of the enveloped viruses, there is a derivative which is LJ001, which is aryl methylidine rhodanine, which is usually used to prevent this viral cell fusion and prevent the infection. Another antiviral strategy which is used is a bevituximab, which is an antiviral drug which is usually used to cure infection in case of human if they are suffering with very chronic and it at a very high stage of risk. Then this antiviral drug is usually given. So this is the summarized page, like the entire PPT in one frame. So this is just a summary which says that Rift Valley fever virus is most common in African regions, and it is a viral zoonosis, and it is usually transmitted from mosquitoes to humans or from mosquitoes to animals that ultimately can infect humans. It is the main source or the main cause of spread is because of climate change. So climate change is the main cause of the disease, and climate surveillance should be done at regular intakes, and heavy rainfalls. In case of heavy rainfall and flooding, people should be more aware and take more precautions. And there should be more research on vaccines that include both humans as well as animals, since there is no such vaccine which is developed which can cure animals as well as humans. Research should more focus on the vaccine that can include both, because humans vaccines have not been developed yet. So these were the sites referred. Usually the main site was World Health Organization, WHO site, and CDC site referred for this presentation. So ending with this is, it is usually said, a quote is there: what is out of sight is all too often out of mind, which indicates that what is out of sight, which people cannot see, which is out of our eyesight, such as any of the viral disease or typically zoonosis disease, is too often out of mind, because we do not care of the disease that we cannot see. We only start caring about it once it is widely spread. So all the we should not neglect such diseases, and we should try to prevent ourselves and take the necessary precautions in order to stop the outburst of such diseases. Thank you for listening.
Very nice presentation, Femida.
Thank you, ma'am.
You have some questions in the chat box.
Yes.
Ruchita Man is asking Rift Valley virus cell culture, which cell line is used?
Ma'am, typically the animal cell lines are only used, till which I have studied, animal cell lines are. Ma'am, my sister.
Hello.
Yeah, ma'am, animal cell lines are used like for primary cell culture. It is usually seen that animal cell lines are used, and for humans, actually, I'm not aware of like which cell lines will be used.
Okay. Next question is to control growth of Aedes mosquito, which specific insecticide can be used?
The normal mosquito repellents can be used.
Okay.
Uh, Hello, hello,
Hello.
ma'am, am I audible?
Yes, yes, dear, you're audible.
Yeah, ma'am, the insecticides, the normal mosquito repellents can be used. However, some of the researchers have shown that there is a mosquito repellent known as Aegypti. If I hopefully I'm pronouncing it right. So Aegypti is the insecticide which is commonly used for RVF, like for mosquito repellent, but it is also used for RVF. If you want to control the spread, Aegypti is usually used as insecticide.
Okay. Okay. Thank you, Famida.
Thank you,
If there are
ma'am.
no more questions for Famida, we can move forward to the second presenter of the day. Second presenter is Priyanka Mishra. She is MSc Biotechnology student, and she will be talking about avian influenza, H5N1 and H7N9.
Okay, am I audible? Okay. So, is the screen visible?
Yes, yes.
Yukta,
Good evening,
please,
everyone. Yes, ma'am.
you start.
Okay. Good evening, everyone. My name is Priyanka Mishra. I'm from MSc Biotechnology. So, avian influenza, many of you might be aware with this term. So, let's take some detailed insights into it. Avian influenza is a type of zoonotic disease which can affect several species of animals, primarily affecting birds, with some strains resulting in high mortality rates. Uh, it has also been isolated from mammalian species including humans, rats, mice, weasels, and etc. So it primarily affects birds. It belongs to orthomyxovirus family. It is enveloped segmented RNA virus. Three strains of influenza virus occurs, which are strain type A, B, and C, strain A out of which strain A is responsible for causing avian influenza, as explained earlier. So, serotypes are classified of avian influenza based on hemagglutinin and neuraminidase proteins. Hemagglutinin is actually a glycoprotein that causes hemagglutination, that is agglutination of RBCs or clumping together RBCs. Neuraminidase, an enzyme which catalyzes the breakdown of glycosides containing neuraminic acid. Based on level of pathogenicity, they have been classified into two types, that is highly pathogenic avian influenza and low pathogenic avian influenza. Highly pathogenic avian influenza can cause several clinical signs or high mortality in birds. Low pathogenic avian influenza that typically causes little or no clinical signs in birds. So here you can see the structure of avian influenza virus. This is H5N1 subtype, while this is a H7N9 structure of H7N9 virus with specific amino acid substitutions. So coming to the history of avian influenza, the Asian origin highly pathogenic H5N1 strain of the avian influenza virus has attracted much attention over the last few years because of significant outbreaks globally in domestic and wild birds. Concern is raised because it not only affects poultry birds but also wild birds as well as mammalian species. Avian influenza occurs worldwide and different strains are made prevalent in certain areas of the world than others. So, the first case of avian influenza was reported in 1997. It was in poultry in Hong Kong, SAR, China. In 2003, it spreaded from Asia to Europe and then Africa. In India, the first case was reported in village of Navapur, Maharashtra, while in 2003, H7N9 virus was reported for the first time in China. But only one fatal human infection has been reported in the Netherlands so far. So here you can see the summary of the deaths that has occurred from 2006 till 2015. Uh, Coming to the transmission of disease, several factors can contribute to the spread of AI viruses, including globalization and international trade, marketing practices, farming practices, and the presence of virus in wild birds. Wild birds can carry the AI viruses in their respiratory or intestinal tracts and usually do not get sick. Historically, wild birds are considered as the reservoir of avian influenza viruses of low pathogenicity. Incubation period for human infection can vary for AI serotypes. Serotypes are actually Serotypes are separate groups within a species of microorganisms that all share a similar characteristic. For example, organisms having the same antigen on their surfaces. So, for example, for H5N1 infection, it can range, it is 2 to 5 days and ranging up to 17 days. While in H7N9, it is 1 to 10 days with an average of 5 days. 5 days. Major sources of virus include infected poultry flocks and live bird markets, feces or respiratory secretions of infected animals, infected wild waterfowl, and minor sources can include the uncooked infected poultry product due to which virus does not get killed because of cooking at high temperature, then H1, H3 from swine to turkeys, and infected pet birds. So here you can see it spreads from avian source to human, and then various mutation or antigenic shift can occur that can cause the pandemic of virus. Then route of transmissions include oral, aerosol and fomites. I hope you all know what are fomites. Fomites are the things through which the infection spread from one person to another person. So fomites such as equipments, vehicles, feed and water, rodents, sparrows, etc. Can be the route of transmission for the infection. So here you can see the cycle of transmission of avian influenza virus. It spread from white birds to poultry and vice versa, and then to human population and other mammals. Highly pathogenic viruses can survive for long periods in the environment, especially at low temperature. Clinical signs of the infection. In the mild form, signs of illness may be expressed only as ruffled feathers, reduced egg production, or mild effects on respiratory system. In the severe form of the disease, the virus not only affects the respiratory tract but also invades multiple organs and tissues that can result in massive internal hemorrhaging. So, symptoms such as quietness and extreme depression, sudden drop in production of the eggs, uh, swelling of skin under the eyes are some of the common symptoms in birds. So, watery eyes, here you can see the pictorial representation, watery eyes and sinuses and swelling of the head, sinuses of the shanks. Sinuses is bluish discoloration of the skin due to poor circulation or inadequate oxygenation of the blood. Then hemorrhage of the trachea. Then here you can see the hemorrhagic skin which is visible under the unfeathered region. And sinusitis can also be caused due to this. Sinusitis is inflammation of paranasal sinus. Paranasal sinuses are air-filled paranasal sinuses are air-filled extensions of the nasal cavity. So coming to the clinical signs in humans, when it affects the central and systemic system, then it causes headache and fever. Affecting the muscles, it causes extreme tiredness, and other symptoms such as runny or stuffy nose, sore throat, aches, coughing, vomiting, etc. can be caused due to this infection. Then AI may be coming to the diagnosis of avian influenza virus. AI may be suspected on the basis of clinical signs and events leading to the disease. Laboratory tests are required to confirm the diagnosis. Tests such as virus isolation in embryonated egg can be carried out, followed by HA subtyping using heme agglutination and others such as heme agglutination inhibition test, RT-PCR, and real-time RT-PCR can be carried out. Or viral RNA detection can be carried out by RT-PCR. RT-PCR is reverse transcriptase PCR, which is a lab technique combining reverse transcription of RNA into DNA and amplification of specific DNA target by polymerase chain reaction. Antibody detection by agar gel immunodiffusion technique can also be carried out in order for confirmation of the disease. So what are the key diagnostic factors that has to be considered for infection? Those are, as explained earlier, the cough, fever, typical influenza signs, etc. Other diagnostic factors such as vomiting, diarrhea, and altered mental status can also be considered. Risk factors that has to be considered are environmental exposure to H7N9 virus or close contact with infected humans or laboratory work with such viruses. So here you can see the picture of how agar gel immunodiffusion test looks like. The first investigation that has to be ordered for diagnosis are CBC with differential liver function test such as alkaline phosphatase, transferase, etc. Then CXR is chest X-ray. It can determine the severity of avian influenza infection. Then pulse oximetry can also be carried out, which is a test used to measure the oxygen level of the blood. Then investigation to considered are viral culture of respiratory specimens, and emerging tests are serological testing for the virus. So this is the picture of how a CXR looks of a normal person and the person infected with the avian influenza virus. And here is the multiplex serological assay for avian influenza virus. First is the sampling carried out, then the assay is carried out with analysis and results. Then treatment. There is yet no vaccine available for humans in India, but research is still going on. Drugs such as amantadine, remantadine, and neuraminidase inhibitors can be used, such as oseltamivir and zanamivir. Amantadine inhibits the replication of the influenza A viruses by interfering with the uncoating of the virus inside the cell. While remantadine rarely prevent the infection, so it is not suggested nowadays. It can only shorten the duration and moderate the severity of influenza infection. So, for treatment, initially, if the unprotected exposed care workers are suspected to be infected with the virus, they have been in close contact with suspected or confirmed case, then first line of treatment is the observation and post-exposure neuraminidase inhibitors that will inhibit the neuraminidase reduction. Then suspected infection. In case of suspected infection, first line is the isolation so that the disease could not be spread to other people. Plus neuraminidase inhibitors can be given. Plus the infection control has to be carried out. Then in case of acute cases with confirmed illnesses, first line of treatment is the supportive care plus neuraminidase inhibitors and infection control. Then, as you all might have heard, as an ounce of prevention is worth a pound of care. So, we can people can carry out the destroying birds who are suspected to be infected with the avian influenza virus, so that they can not spread the infection. Disinfection of the poultry has to be carried out regularly. Limiting, restricting, or banning the shipment of animals from the places where the cases have been reported of avian influenza. Then further steps that are required for controlling the disease are national biosecurity for risk management practices against risk posed by diseases and organisms, farm biosecurity practices to help keep infectious diseases and weeds off a property. Then food biosecurity for analysis and managing risks in food safety, animal and plant life and health biosafety. Personal biosecurity includes personal hygiene practices such as wearing gloves, goggles, boots while exposure to infected poultry animals, etc. So avian influenza overview report is published quarterly by three groups, that includes European Food Safety Authority, European Center for Disease Prevention and Control, and the European Union Reference Laboratory for Avian Influenza. So these are the steps that how avian influenza infection has to be controlled. Current research with respect to avian influenza include two clinical trials testing an experimental vaccine to prevent to prevent avian influenza infection. It tests different dosages of the inactivated influenza vaccine candidate called as 17H7947, as well as different vaccinations schedules. They will also evaluate whether or not adjuvant would be helpful in boosting the immune response. Adjuvant is a substance that is co-injected with the antigen in order to help stimulate and enhance the adaptive immune system into producing antibodies against infectious agent. So these one clinical trial is led by Dr. Lisa A. Jackson, while other is led by Dr. Kathleen M. Newsiel. These are the references. Do you have any questions?
Priyanka, very nice presentation and very informative. Yes, you have few questions here. I will be reading out.
Yes.
Uh, Please explain some important characters of orthomyxovirus.
What? What, ma'am?
Explain some important characters of orthomyxoviruses. Priyanka.
Hello, hello.
Yes, can you hear me?
Hello,
Hello, Priyanka, can
am
you?
I audible?
Yes, you are audible. Can you hear me?
Yes, ma'am, I can hear you.
Yeah. So the question is explain some important characters of orthomyxovirus.
Orthomyxoviridae is actually a family of viruses. It includes several genera such as alpha influenza virus, beta influenza virus, delta influenza virus. Uh, the first four genera of viruses that can cause influenza in vertebrates such as in birds, humans, and other animals.
Okay. Next question is what is the difference between H5 and H7 protein?
This is actually a difference between a heme agglutinin protein.
Okay.
How these proteins are different from each other? Hello, Priyanka.
Ma'am. Yes, ma'am.
How these proteins are different from each other? You have H1N1 infection, you have H5 wala strain, you have H7 wala strain. So I guess these are the different strains of one single virus only, right? So if I'm
Yes,
saying
ma'am.
one is having H5 protein, another is having H7 protein, there has to be some difference, na? So what do you think? The difference
Yes,
is
ma'am.
there in what? When I'm saying in the two proteins, the differences are there. The difference lies in what?
Amino acid sequences.
Yes, that is the primary structure of protein is different.
Yes.
Okay. Okay.
The next question is generally viruses are host specific, but in these viruses, how they are changing its host from animal or bird to humans.
What, ma'am? I could not hear you.
Generally, viruses are host specific, but in these viruses, how they are changing its host from animal or bird to human.
So actually, ma'am, influenza virus is a segmented type of virus that has 8 RNA segments. So different, this segmented property of this influenza virus allows it from different species to mix and create a new virus. If for example, two different influenza strains have infected a same person, then infected the same person or animal, then they can mix together and form a new type of virus. So this is actually called the antigenic shift, due to which the virus can mutate and cause infection in different people, in different species.
Okay. So are there any vectors or
Yes, ma'am, there are vectors. Through wild animals, it is transferred to it is transferred to poultry birds through their various respiratory or fecal secretions. Then from poultry birds, it is transferred to humans when they come in contact with them.
okay. Does this disease
But
transmit from
no,
person to person?
yes, if the if a normal person will come in contact with the infected person, then it can transfer.
Okay. Then why eggs are used for cultivation of viruses? Any specific egg is used for this?
Uh, Embryonated egg is used for the cultivation of virus. Usually 8 to 10 days old embryonated egg is used for cultivation of this virus, as we can see how the virus is affecting the growth of embryo.
Okay. Next question is what is the difference between H5N1 and H1N1?
That is basically a serotype difference. Uh, they have different second amino acid structures. For example, they have differences in primary, secondary, and tertiary structures, and have different heme agglutinin and neuraminidase proteins.
Okay. Uh, Over here, Tulsi Gupta is asking outbreak. Tulsi, I didn't get your question. Can you unmute yourself and ask?
Ma'am, I asked that what is the outbreak of this virus, like where it has been originated or where it has been spreaded from?
So actually, the first case was reported. Here you can see in the history, the first case was reported in Hong Kong, China. Then it spreaded from there to different Asia, Europe, and African countries. Then in India, it was reported for the first time in 2006, and hence the series started. Did you get it?
She
Hello,
left the
Tulsi.
meeting. She left the meeting. Yeah, yeah, she got it. Yeah, thank you, Priyanka. It was very informative PPT. Our next
Okay,
presenter is Sarvesh
thank you.
Chore from MSc Microbiology, and he will be presenting on pandemic influenza H1N1 2009.
Hello.
Yes, Sarvesh, you're
Uh,
audible.
yeah, ma'am. Okay. So I'm going to explain about the disease, the pandemic influenza H1N1, which we saw the outbreak in 2009. Okay. So this presentation is going to cover the epidemiology of this virus, this swine flu, as we know of, the mode of transmission, its clinical features, diagnosis, management, prevention, control, and national response. Okay, so the structure of virus is mainly it's a very simple virus which it mainly contains two surface proteins, which is neuraminidase and hemagglutinin, because of which it has the name H1N1. The H stands for hemagglutinin and the N stands for neuraminidase. Okay, so this H1N1 influenza virus was a novel strain due to antigenic shift, as we saw in the previous slideshow. That this antigenic drift or antigenic shift is because of reassortment between two or more different types of virus strains. Now, this happens when two different types of viruses, for example, avian influenza virus and swine flu virus, infect the same cell, which is generally the mucosal epithelium in the respiratory tract. They will sometimes release their RNAs into the cytoplasm, which may get combined and then release as one virus particle. So that is what we call as the antigenic shift. Now, this influenza outbreak was seen in April 2009 when the WHO declared the emergency. And in June 2009, the WHO raised the pandemic alert from phase 5 to phase 6, which means the phase 5 means the spread of the virus or the spread of the disease is contained in at least two countries, and phase 6 means the spread has occurred more occurred in more than two countries, or you can say all over the world. Okay, so this is the worldwide distribution of the pandemic, and as we know, the virus first had its outbreak in the USA in April 2009. So what are the epidemiological determinants? The first, obviously, we know that the causative agent is H1N1 influenza A virus. So what are going to be the host factors? The host factors, as we know, the host factors. Okay, so the host factors are, we can see that the disease can be spread in all individuals regardless of the age or gender or anything, because the population is not immune to the virus at all. Obviously, the complications are going to be higher in people who are already having diseases like asthma, cardiac diseases, especially COPD, which is chronic obstructive pulmonary disease, or renal diseases, or especially for women who are in pregnancy, they're going to have higher complications. Also, obesity plays a important role for the severity of the disease. Now, how does this virus react to the environment? As we know, this virus is very, very resilient in the environment, that it can survive in the environment for quite a long time and is also still active or infectious after a very long time. Also, the infection rate is quite high in low temperatures and low humidity environmental factors. Because of this, we can see that the virus generally infects in the colder seasons, or we can say the infectious, we can see the seasonal nature of this virus or this infection, which is right from October up till March, and the peak season is from November to February. Also, in tropical climates, infections are more seen during the rainy seasons because there is low temperature also. And this virus is very easy to spread among the people, and especially it is very severe for the people who are having already pre-existing diseases to them. Okay, so the mode of transmission is very similar to that of COVID-19 as we are looking right now. It is same as it spreads through droplets which are formed due to coughing or sneezing, or through direct contact or indirect contact with the respiratory secretions of an infected person. Also, we know that the food is not yet known to be the vehicle of transmission. That is, we can eat non-vegetarian foods and still not get the virus if it's properly cooked. The secondary attack rate in the households is approximately 18 to 13%. That is, if a person is infected in your own house, then the chances of you getting that same virus or same infection is approximately 18 to 30%. As we saw that this virus is an assortment of already existing viruses. So it came from bird flu and human flu, which is combined together, which showed an antigenic drift into the swine flu, and which then got infected to the humans, and then the humans will spread from one human to another. And as we know, the name of the virus is swine flu, but still it is not contracted to humans from a pig. It is rather only contracted from a human to another human, but the name still exists because it was first transmitted from a pig to a human. The incubation period is between 1 to 7 days, which is quite distinctive from the normal common fever virus or common influenza virus, because it shows only an incubation period between 1 to 3 days only. The period of communicability is obviously approximately 24 hours before the person shows symptoms and 24 hours after the symptoms have subsided. Okay, the clinical feature of this virus is quite wide, you can say, because it can be only mildly affecting the upper respiratory tract, which will be limited only to that region, or it can be spread to the lower respiratory tract, which can cause ARDS, which is acute respiratory distress syndrome, or you can say shortness of breath or breathlessness. Also, it can cause cardiac involvement, neurological involvement, multi-organ failure, especially the renal tract or the urinary tract and the digestive system. It can also be the virus can also enter into the bloodstream and cause septicemia, and ultimately can cause death also. The common features are mild respiratory illness with fever, cough, sore throat, dyspnea, which means breathlessness or short breathedness, rhinorrhea, which is runny nose and watery eyes, myalgias, which is nothing but body pain, chills, headache, and fatigue. In seasonal flu, we can also observe that the virus can also show, the infection can also show diarrhea and vomiting in the infected person. The complications are quite few, but they can be myocarditis, pericarditis, which is nothing but the cardiac diseases, can cause encephalitis, myositis, multi-organ failure, and toxic shock syndrome also. The diagnosis is quite common, and the best way of diagnosis and also the most effective and time-saving is the RT-PCR or reverse transcriptase polymerase chain reaction. The clinical diagnosis can be done also with a simple OPD checkup, and the prevailing infections can be, according to the prevailing infections, the doctor can diagnose the infection. The case management. Now, how do you manage a case which has been seen to be positive? Now, hospitalization and antiviral therapy are not required for most of the patients. All of the patients will not require hospitalization. The supportive, if a patient is suffering mildly, then the supportive care includes antipyretics or anti-fever drugs like paracetamol, acetaminophen, or some antipyretic simple drugs. The virus is quite susceptible to neuraminidase inhibitors or N inhibitors, which is most commonly used as oseltamivir oseltamivir or zanamivir, which is commercially available as anti sorry Tamiflu or anti-flu. Okay. The antiviral therapy is beneficial especially for pregnant women, patients with progressive lower respiratory tract disease or pneumonia, and those with underlying medical conditions. Okay, so the prevention and control measures for this disease are, first of all, the prevention measures which will not include medicines are called as non-pharmacological interventions, which is the first one in which we can see the personal protective measures is simply covering your mouth while coughing or sneezing and frequently washing hands with soap and water. If you are feeling that you may get infected or you are infected or somebody else may have been infected around you, then you can undergo home quarantine. And also for small children, you can stop them from going to schools, which is school closure and cancelling of mass gatherings or parties, etc. Now the preventive measures which are including medicines are, the first one is chemoprophylaxis. As if you feel that if you know that you have been in contact with a person who has tested positive for the disease for swine flu, then you can, and then the doctor will ask you to undergo a therapy for 7 days in which you will be given oseltamivir or zanamivir for prophylaxis. Other interventions are pharmacological interventions, which is vaccines. Now, vaccines against H1N1 is presently available in a few countries. The commercial production is commenced already, that we know, and yearly vaccines are available. Now, always remember these viruses are quite mutating quite fast because these are RNA viruses, and also they are already having the antigenic shift which helps them to mutate even faster. So every year you have to be immunized regularly, otherwise only one time immunization is not going to help for the next or coming years. Obviously the first priority to immunize is going to be the healthcare workers, and the next priority would be pregnant women and immunocompromised individuals. Okay, how did the nation respond to this? We established a national influenza surveillance network. Other was molecular diagnostic assay based on surveillance started in 2009 using the RT-PCR at National Public Health Laboratory (NHPL), and influenza pandemic preparedness project was implemented by PHS under the grants from CDC. Thank you. Now you may ask if you have any questions.
This very nice presentation, Sarvesh. You have few questions in the chat box.
Yeah.
Ruchita ma'am is asking, enveloped virus and naked virus. If we compare these two, which type is more pathogenic?
Yes, ma'am. Hello.
Yes, Sarvesh. The question is, enveloped virus and naked virus. If we compare these two, which type is more pathogenic?
Okay, ma'am. So generally, the envelope viruses, which are having a coat outside of them, they are generally more pathogenic because they can fuse with our cell walls, the cell membranes, and enter quite easily. And also, when they get out of the cells, they can also take our own cell membranes as their own coatings. So they are quite more infectious or pathogenic than the naked viruses.
Okay. The next question is, what exactly happens in incubation period of any virus?
Okay, in the incubation period, the virus generally, now most of the viruses which are DNA viruses, they incorporate their genetic material into the host's DNA or into the host chromosomes, and then they can replicate or they can produce their own proteins. But in RNA viruses, as we know, they generally they do not need to uh, inculcate or insert their genetic material into the host's DNA. Now, because of this, as we know, in RNA viruses like this H1N1, they generally have this time period or incubation period for producing their proteins inside the host cell, and then assembling those proteins into virus particles and releasing them out of the cell. So the time for them to the time required for them to produce those proteins and assemble those virus particles and then release them out of the host cells is the incubation period.
Good.
Okay. Uh, Next, Rohan is asking, what is myalgia?
Myalgia is simply muscle pain or body ache that we feel during fever. When we feel tiredness or the body pain that we feel is simply the myalgia.
Okay. Next, Harsh is asking, is there any avian influenza virus strain which shows the capability of transferring the virus from humans to animals?
Avian influenza virus strain, which shows the capability of transferring the virus from humans to animals.
Mm, as far as I know, I am not aware of this much, but I'd like to find
Uh,
it.
is this question for me, ma'am? Avian influenza?
Yes, you know the answer. You can answer to this question.
Yes. As such, there are no reports are there for transfer of avian influenza virus infection from humans to animals. It can as till today, only the cases of transfer from animals to humans have been reported, or human to human transmission can take place, but that is also to a limited population.
Yes. Okay. Thank you, Priyanka. The next question is, what is
Welcome.
toxic shock syndrome?
Hello?
Sarvesh, yes. The next
Yeah.
question is, what is toxic shock syndrome?
Toxic shock syndrome. Now, this
Yes.
is generally when now toxic shock syndrome is generally seen in bacterial infections where the bacteria will go into the bloodstream and infect all over the body, and the body will get a shock order because of the toxins produced by the bacteria. The body will go into a shock, which is simply the toxic shock syndrome. Now, this is not generally seen with influenza viruses as such, but it may be seen in a few cases.
Yes. Okay. Next question is, Rohan is asking, what is the rate of effectiveness of oseltamivir against the virus?
Okay, the rate of effectiveness. Now, obviously, this it's quite susceptible. Almost now, as we know, the infection, the pandemic was seen only about 19 months, which is starting from January 2009 up to August 2010. So it was not quite, and because of that, we can see that the rate of effectiveness of this oseltamivir was quite good, because it can prevent almost 80 to 90 80 to 85% of the patients. So it was quite effective, we can say.
Okay. Next question is, why RNA virus mutates so often?
Okay, RNA viruses, because they have genetic material as RNA. RNA is quite unstable as compared to DNA. So because of this, because its instability, it is often seen that the RNA will mutate, or RNA will change its uh, nucleotide arrangement, and because of that, we can see quite a lot of mutations as compared to DNA viruses.
Okay. Then you have next question from Dhanashri. As you said, vaccine is available for this virus, but this virus mutates regularly. So is the vaccine effective for every mutated virus?
No, 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 definitely not. It is not effective against all the virus, all mutated viruses. Because of this, we have to prepare a vaccine every year, and flu shots are available. Yearly flu shots are available for the vaccine for the vaccination, because this virus is quite easy to mutate. This virus is very easily mutated, so obviously you cannot get immunized with only one vaccine. You have to get vaccinated every year.
Okay. Next question is from Pratik. Is swine flu and Spanish flu the same?
Uh, yeah. It is same, but it is not exactly like the H1N1 that we saw. It is quite different because it was before the assortment of these virus strains from bird flu and swine flu together. In 1918, I guess it was the swine flu or the Spanish flu, which was had the outbreak. And at that time the virus was not as much had did not have as much as assortment as this H1N1. So we can say it was the first type of strain, or the first strain that we actually saw of H1, or the influenza A virus that we saw, which itself then converted itself into the H1N1, which we saw in 2009 as swine flu.
Okay. Thank you, Sarvesh. It was very well explained.
Thank you, ma'am.
Our next presenter is Shwetalin Panda. She is from MSc Biotechnology and she will be presenting on West Nile virus.
Ma'am, am I audible?
Yes, yes, dear.
Okay. Should I begin?
Yes, dear.
Good evening,
We,
everyone.
we cannot see your PPT, Shwetalin.
Okay, wait a minute, ma'am.
Yeah.
Is it visible now, ma'am?
Yes, dear.
Okay. Okay, good evening, everyone. Myself, Shwetalin Panda from MSc Biotechnology, Patkar College. I'll be giving you the insights of the very fresh topic today, that is West Nile virus, which is a zoonotic disease. Like, it is a new topic, so let me give a brief introduction about it. West Nile virus infection, which is also called as West Nile fever or West Nile encephalitis. Encephalitis is a term used for inflammation in our brain. This virus is a type of arbovirus. Arbovirus comes from the term arthropod borne. West Nile, and they are the member of Flavivirus genus and family Flaviviridae. Other flaviviruses that affect humans include yellow fever, Zika, and dengue. West Nile virus is the leading cause of mosquito-borne diseases in the continental United States. They commonly spread in people by the bite of an infected mosquito, which starts in the summer and continues through the fall, that is during the winter time. There are no particular vaccines to prevent or medications to treat this infection in people, but fortunately, most of the infected patients or the people by this virus do not feel sick. Like, after the introduction, let's see what is West Nile virus all about. Till date, the strains of West Nile virus have been commonly found in humans, birds, and other vertebrate animals in Africa, Eastern Europe, West Asia, and the Middle East. Prior to 1999, West Nile virus had not been recognized in the West Hemisphere. The first recorded epidemic within the region was Israel which was found in Israel in 1950s and in Europe in the year 1962. And a subsequent outbreak also occurred in New York in 1999. The West Nile virus is closely related to the Japanese encephalitis virus and St. Louis encephalitis virus, found in southeastern and midwestern United States. Now let's see what are the causative agents. It generally has only a mosquito which is infected, which infects other. This mosquito is often referred to as a house mosquito or the West Nile virus mosquito. So basically the main causative agent here is a type of mosquito which is named Culex pipiens. So how it infects, we'll see that in the mode of transmission. This West Nile infection is most commonly spread among the people by bite of an infected mosquito. This mosquito is infected because they feed on the infected birds. The infected mosquito then spreads West Nile virus to people and other animals by biting them. Now, let us see what and how this virus spreads. It can be due to exposure in the laboratory settings, or blood transfusion and organ donation during the process, mother to baby during pregnancy, delivery, or breastfeeding. As I was saying, that this insect, that is mosquito, Culex pipiens, is a vector which transmits the infection from infected birds to humans or other animals. Now we are aware of how viruses spread, so we should also understand that how it doesn't spread. So by coughing, sneezing, or by touching live animals, or from handling live or dead infected birds, it does not spread. But still, we can avoid barehanded contact while handling any dead animal. If we are disposing a dead bird, we should use gloves to place the carcass in a garbage can. Now, as we all know, that prevention is better than cure. The most effective way to prevent ourselves from this infection is to prevent ourselves from bites of the mosquito. Mosquito bites can occur during day or night. So what we can do is use insect repellent, wear long sleeved shirts and pants. Or we can take steps and to control mosquito indoors and outdoors. What can a person do to reduce? As I earlier mentioned, that we can stay indoors at dawn, dusk, in early evenings, and wear long sleeve shirts and long pants when outdoors. And we can also apply EPA registered insect repellent sparingly to exposed skin and clothing according to the manufacturer's instructions. EPA registered is the review that gives the reviews of the product that are labeled as for licensing and are then registered for the process of the pesticides. This EPA registered products usually consist of various sprays, repellents, and the pesticides. An effective repellent which contains 20 to 30% of DEET are very useful. Other than DEET, we can also use picaridin, which is a newer repellent that is effective and can long last as same as the DEET against mosquitoes. Here the point is to note that we cannot use DEET higher concentration, that is above 30%, because it may cause side effects, particularly in children and babies, but we can actually extend it up to 50%. Like pregnant women can use it, but still we should avoid using the DEET in greater amounts. Then there's treatments. As I earlier mentioned while introducing it, that there are no prominent vaccines or specific antiviral treatments for this virus. So we have over-the-counter pain relievers that can be used to reduce the fever and relieve some symptoms. But this is only in the milder cases. In severe cases, patients are often hospitalized to receive supportive treatment such as intravenous fluid, pain medications, nursing care, etc. There is no specific antibiotics, so no vaccines are present present now till date to prevent the virus. Most people recover from West Nile virus without treatment. There are other symptoms. There are some symptoms that can help the doctor to prescribe that or can help the doctor to say that this that we are that the disease caused is due to, or the infection caused is because of the virus. The symptoms can be fever, headache, body aches, fatigue, back pain. These are the symptoms which are commonly found, but skin rash, swollen lymph glands, and eye pain are some occasionally symptoms found. The researchers found are currently in the year 2019, progress of avian vaccines against West Nile virus was found by the scientist Nierda et al., giving an idea on how these vaccines can be used to preserve the endangered species of the birds. It is only licensed, but is only licensed for the use in squids till date. Another research for comparative pathology of West Nile virus in humans and non-humans or non-human animals was conducted in the year 2020 by Alex D. Bias and Gregory D. Ibel, stating that the well-known finding in human infections involve the central nervous systems, but West Nile virus can also cause significant lesions in heart, kidney, eyes. A gap in the current literature exists regarding the relationship between the neurotrophic nature of these virus in vertebrates, virus propagation and transmission in nature. These are the references. Thank you.
Thank you, Shwetalin. It was a very nice presentation. You have some questions. How blood transfusion is responsible for virus transmission?
Sorry, ma'am, what? How blood?
How blood transfusion is responsible for virus transmission?
Usually, doctors do check or do blood samplings while before blood transfusion, but there are chances that as we know that mosquitoes bite us, so the virus can uh, spread through blood. So the virus gets injected with the help of the vector inside the blood. So while transfusion, there are chances that it gets spread to the other
Hello,
person.
hello, Shwetalin. My
Yes,
question is, suppose any mosquito has bite the individual, and that virus, suppose it has been released in the human blood, in a healthy human, okay, healthy human body. So, in the healthy human body, for how many days that
sorry,
virus is
ma'am.
going
Can
to
you please
survive?
repeat? Hello, ma'am.
Hello, Shwetalin.
Hello, ma'am. Can you please
Hello.
repeat the question?
Suppose the virus is released in the healthy human body. For how many
Yes.
days he's going to survive in the blood? It's like, suppose if I'm saying blood transfusion, we never do
Yes,
blood
ma'am.
transfusion from one person to another person directly. The
No,
blood
ma'am.
which is stored in blood bank, right?
Hmm.
The blood which is stored in blood bank, generally that we
Yes, ma'am.
use.
Hmm.
So that also, what you can say, it is a stored type of blood in which they must have done variety of tests before if its preservation. So my question is that, suppose if I have removed the blood from one individual, we don't know that time that yes, that person is having infection of this particular type of virus or any kind of virus. और मैंने उसको स्टोर किया, रेफ्रिजरेट किया, क्रायो प्रिजर्व किया, जो कुछ भी करते हैं वो लोग. So
Huh?
during this preservation, is that virus is going to survive only in blood? मतलब आई एम नॉट कंसिडरिंग द ह्यूमन. हाँ, मैं पूरा ह्यूमन बॉडी नहीं कंसिडर
In
कर रही हूँ, मैं सिर्फ
storage.
ब्लड.
No, ma'am. It
तो
won't
उसका,
survive. It needs a host.
हाँ, तो वही मैं बोल रही हूँ कि फिर ब्लड ट्रांसफ्यूजन में वो कैसे जाएगा. आई एम नॉट गेटिंग दैट पर्टिकुलर पॉइंट.
Okay.
If I'm considering blood transfusion में you are using the blood which is already stored in the blood bank which has been removed from any particular person. We don't know कि वो person को infection है नहीं है, पता नहीं अपने को, पर
Yes,
मैंने वो
ma'am.
सपोज यूज किया, तो उसमें वायरस
Huh.
सरवाइव कैसे करता है ड्यूरिंग प्रिजर्वेशन? उसमें वो सरवाइव कर रहा है तो
During
ही.
preservation, it won't survive, ma'am, during preservation because it requires a host.
Okay,
So,
so
yeah.
what is the actual organ, target organ for this virus? See, for example, if I consider,
Target organ. Yeah.
sorry.
Target organs are heart, kidney, eyes.
Okay.
Okay. It can
Okay,
also cause damage to central nervous system as well.
but that is the, what I can say, final in the ultimate condition. If we don't give treatment
Yes.
and if it
No, ma'am,
spreads
no
throughout the
particular
body.
treatment. No particular treatments are right now available, but we can
Okay.
treat them. The milder cases can be treated using some painkillers like aspirin.
Okay, fine. That was the question, that how
Okay.
it will be, how it will survive in that particular blood. Okay.
Okay.
Okay,
Any other
so
questions, ma'am?
yes, uh, Uditi Jaisal is asking, what are the side effects caused by DEET if present in higher concentration?
Side effects such as rashes, boils, and
Okay. Then Harsh is asking, can this virus transfer from mother to fetal baby?
yeah, no, there are chances that it can pass the like we do. Usually, there are no chances of viruses passing from mother to baby because there is a protection layer. But still, it can pass because there are chances that
Okay. Then you have next question. Total how many days are required for complete recovery without any treatment? Shwetalin? Shwetalin, are you there?
hello, ma'am. Yes, yes,
Yes,
ma'am,
the
I am
question.
there. What was the question? Can you repeat?
Total how many days are required for complete recovery without any treatment?
If the case is mild, then we can recover in 3 to 6 days. Because as I earlier mentioned, very few people are affected by these viruses. Like they are infected, but they tend to cure within the cells. RBCs tend to cure within itself, but they are very. If the case is like severe, it can lead to death also. Because
Okay.
as there are no proper, they can be allowed to live in support systems, but there are no proper medications yet.
But as it was said earlier by you that avian vaccination can be used over here. So how does it work
Sorry, ma'am.
exactly? Kavita, can
Hello,
you please
ma'am.
mute yourself? Okay, yeah. Sorry for the disturbance. Yes, as it was said by you when presenting the PPT, that avian vaccination can be used for West Nile virus. So how
Yes,
exactly it
ma'am.
works?
But that cannot be used for humans. Till date,
Okay,
it is only licensed for squids.
okay. Then you have next question. What birds can get infected by West Nile virus? Does it infect any specific species? Shwetalin?
Hello.
Shwetalin, can you
Hello.
hear
Am I
me?
audible? Am I audible? Hello, ma'am.
Yes, yes, dear, yes, dear.
Yes, ma'am. The birds that can be infected are not of any particular species, but yeah, sparrows or hawks, like different types of birds can be affected by this or infected by this virus.
Okay. Then Pratik is asking, what are the clinical signs of West Nile virus infection in individual horses?
Sorry, ma'am, can you repeat the question?
What are the clinical signs of West Nile virus infection in individual horses?
No, I don't have any idea. It's not. I'll have to search on that.
Okay, okay, no problem. It was a very nice presentation. Thank you,
Thank
Shwetalin.
you, ma'am. Thank you, ma'am.
So our next presenter of the day is Bipasha Sarkar from MSc Microbiology, and she will be presenting on yellow fever.
Am I audible, ma'am?
Yes, yes.
Is my slide visible?
No, yes, it is. It is.
Okay, thank you, ma'am. Okay, so good evening, everyone.
Yeah, it is visible. Sorry.
Okay, sorry. Good evening, everyone. So the next topic that I'm going to present is about yellow fever. So what is yellow fever? Yellow fever, it is an acute viral hemorrhagic disease which is caused by yellow fever virus. So the name in the yellow fever, yellow name refers to the jaundice that affects some patients. Therefore, the name is yellow fever. Now, these viruses, they are the arboviruses, that is arthropod-borne virus, meaning that these viruses, they require arthropods so that they can be carried and transmitted. These viruses, they also belong to the family Flaviviridae. So this family, they have small single-stranded RNA virus, meaning that the genetic material, it consists of a single strand RNA, and their diameter size, they ranges from 40 to 60 nanometer. These viruses, they are also envelope viruses. Envelope is a flexible coat which is basically made up of lipids and fats that protect the nucleocapsid within which is the genetic material. uh, Here the second picture, this is the picture of transmission electron microscope, which is showing the yellow fever virus. Next is the history of yellow fever. So this yellow fever virus, they originated in Central Africa, and it was brought down to the Western Hemisphere during the slave trade era between 16th to 19th century. And the first epidemic was reported in the Yucatan Peninsula, Mexico, in the year 1648. And over the ensuing winter, the outbreak widely occurred in tropical America, the North American coastal cities, and Europe. Also, a recent outbreak of this disease was recorded in Angola 2015, where 1,132 suspected cases and 129 deaths they were reported so far. As you can see from this world map, the yellow region, these are the risk areas, whereas the green region, these are the risk-free areas. So it is clearly visible that it is mostly the Central Africa and the South America. Next, how this yellow fever is transmitted. So as I said, these are arthropod viruses. So yellow fever virus is transmitted through the mosquitoes. Usually the mosquitoes which carry and transmit them, they belong to the Aedes species and the Haemococcus species. Also, it is seen that for specific region wise, in Africa, it is mostly the Aedes aegypti which transmits these yellow fever virus, and in South America it is the Haemococcus species. So here I've put a picture of mosquito. These belong to the Aedes aegypti. So there are generally three types of transmission cycle. One is the sylvatic or the jungle transmission, second is intermediate transmission, and third one is urban transmission. So in jungle transmission, so in the tropical rainforest, the monkeys, they are the primary reservoir for this yellow fever virus. And when they are bitten by this wild type Aedes or the Haemococcus species mosquito, so they carry this infection and they transmit to the other monkeys. Now, usually a person who is traveling or working in the jungle, he is bitten by this infected mosquito, then he or she develops the yellow fever. So next is intermediate transmission. Now in this type of transmission, it is the semi-domestic mosquitoes. Contact between the people and the infected
Hello,
mosquitoes.
Bipasha.
This
Hello,
will lead
Bipasha. Bipasha. Bipasha, you're not
Hello,
audible.
ma'am, can you hear me now?
Yeah, we can hear you now. There was some metallic sound in between. Can you repeat again?
Yes, this the same slide.
Yeah.
Okay, so how yellow fever virus they are transmitted? So as I said, these are the arthropod borne virus. So yellow fever virus, they require mosquitoes so that they can be transmitted to others. So mosquito belonging, generally the mosquitoes which carry, they belong to Aedes species and the Haemococcus species, and it is seen like for a region specific area. Like in Africa, it is mostly the Aedes aegypti which transmits this yellow fever virus, and in South America, it is mostly the Haemococcus species. So the picture over here I've put, this is an picture of an Aedes aegypti mosquito. Now there are basically three types of transmission cycle. One is the sylvatic or the jungle transmission. Second is the intermediate transmission, and third is the urban transmission. So in sylvatic or the jungle transmission, Here in tropical rainforest, the monkeys, they are the primary reservoir of this yellow fever. And when a wild type Aedes species or the Haemococcus species, they bite this monkey, they will then transmit this disease, this virus to the other monkeys. And occasionally, if a person who is traveling or working in a jungle is bitten by this infected mosquito, he she develops yellow fever. Second is the intermediate transmission. So over here, in this type of transmission, it is the semi-domestic mosquitoes, meaning that those breed in jungle as well as in households. So these mosquitoes, they can infect both monkeys as well as humans. And whenever there is an increased contact between the people and the infected mosquitoes, it leads to the increased transmission, also outbreaks in villages. So this is the common type which is seen in Africa, this type intermediate transmission. And third is the urban transmission. So in this transmission, large epidemics occur because here the infected person, he introduced the virus into heavily populated area with high density of Aedes aegypti. And here most of the people, they have little or no immunity due to lack of vaccination or prior exposure to yellow fever. So in this type, the infected mosquitoes, they can transmit virus from person to person. Next is sign and symptoms. So the incubation period for yellow fever is generally 3 to 6 days, and most of the common symptoms which are observed, they are fever, muscle pain with prominent backache, headache, loss of appetite, nausea, or vomiting. Usually, these symptoms they disappear within 3 to 4 days. However, a very small percentage of patients, they enter into a second, which is more toxic phase within the 24 hours of recovery from the initial symptoms. So high fever, in this phase, high fever, they hit backs affecting several system of the body. So there is system failure of the liver and the kidney. Some people, they tend to develop jaundice. There is formation of dark urine, abdominal pain with vomiting. Even bleeding can occur from the mouth, nose, eyes, or stomach. And it is usually observed that the patient who enter this toxic phase, half of them, they die within 7 to 10 days. So what is the treatment for this particular? So that unfortunately there is no medicine to treat or cure infection from yellow fever. However, good and early supportive treatment in hospital, it can improve the survival rate of the patients. So their main aim is by controlling the symptoms, by giving them rest, fluids, and use of medicines that can help to relieve the fever as well as aching. And special attention is paid to treat the dehydration, liver and kidney failure, as well as fever improve outcomes. And if a person is associated with bacterial infection, they can be treated with antibiotics. Next is prevention. So how we can prevent? First important step is the vaccination. So live attenuated vaccines, they are given for preventing the yellow fever, and it is the yellow fever 17D vaccine, which is the only one which is commercially available. And the advantage of this vaccine is it is very safe and it is affordable, and only a single dose, it can provide lifelong protection against this yellow fever disease. So there is no necessary to give a booster dose. Also, second important thing is the vector control. So in order to control the mosquito breeding sites, we can apply larvicides to the wherever the water is stored or the stagnant water. Also, personal preventive measures such as clothing, so that our skin is exposure is minimized, and use of the repellents, they can avoid mosquito bites. Also, use of the insecticide treated bed nets can be used, limited by the fact because this Aedes mosquito, they bite during the daytime. So what are the current researches? So one group of researchers, they have found that there is a change in the white blood cells which could signal an early sign of this fatal yellow fever. So as these events they occur in the liver, so there is a preceded by severe loss of lymphocyte. So if we can spot the decrease in the number of this lymphocyte, it can be very useful in managing these cases, as it will provide an earlier clinical outcome to measure like how severe is the disease. So it can provide a good prognostic tool to the doctor, so he can she offer more aggressive support care to these patients. Also, current researchers, they are aiming to evaluate the long-term persistence of neutralizing antibodies to yellow fever virus following routine vaccination in infancy. Thank you.
Thank you, Vipasha. It was a good PPT, very well explained. You have some questions in the chat box.
Yes.
So Harsh is asking why these viruses are only carried by arthropods, why not other animals or insects?
Mm. So, ma'am, I actually don't know this answer, like why it is specifically in arthropods only.
Okay, okay, no problem. Then Ruchita ma'am is asking why yellowing of eyes, why yellowing of skin eyes occurs in this fever. There are chances that it can be diagnosed as jaundice as well. So how to differentiate between these two conditions?
So, ma'am, there are diagnoses for yellow fever. Like there are serological test where ELISA they can be used for the antibody IgM, which is specific to the yellow fever virus. And jaundice is a so by if the ELISA if there is a high in titer of this IgM antibody which is specific to the yellow fever virus, so we can differentiate that he or she is infected by yellow fever virus. Also, there are
Okay, but do you
RT-PCR detection test for detection of the viral genome.
okay, but do you know why there is yellowing of skin eyes in this fever?
Ma'am, because there is increase in the bilirubin which is accumulated in the blood, and therefore which results into this yellowing of the skin and eyes.
Okay, very good. Then Tulsi is asking why, while transmission from mosquito to human, is this viruses are present in the gut of the mosquito?
Yes, ma'am. These viruses they are basically present in the gut of the mosquito in the salivary gland, and from there they are the mosquito bites, it get transmitted.
Okay. Then Abhishek is asking in silvate transmission, can it cause to any water mammals or water animals?
No, ma'am. This yellow fever virus, in case of cell-wide transmission, doesn't cause to any water mammals or animals.
Okay. They are
It is
actually
only the
basically wild animals,
yeah. It is basically wild
if I'm
animals.
not wrong. Yeah. Then Rucha is asking, does the virus not mutate? How is single dose of vaccine enough?
Uh, these it is usually not seen that this virus um, they have been muted, and uh, through the particular test, like while doing the clinical trials, have the researchers they have seen first, the large doses of the vaccine they were given to the patient which were under the study. So there were a lot of side effects which were seen. So they saw then studying again in the next group of participants, they showed that only a single dose is enough. So there is no need to give any booster dose.
Okay. Then Pratik is asking, how long did yellow fever last?
As I said, there was a recent outbreak which was seen in 2015, Angola, and um, from there till only reports are coming from there, like how many people has been suspected or how many are deaths.
Okay. Thank you, Vipasha.
Welcome,
Then
ma'am.
our next presenter is Shruti Gowde from MSc Microbiology, and she will be presenting on SARS.
Hello, ma'am. Am I audible?
Yes, dear, you are.
Ma'am, can you see the PPT?
Yes.
Okay. Good evening, everyone. So, I'm going to talk about the first pandemic of the 21st century, that is the severe acute respiratory syndrome, also known as SARS. So let's go to the history of this disease. So on November 2002, in a region of China named as Shunde, there was sudden deaths among a particular set of farmers. So these farmers used to show flu-like symptoms, and after a week of showing these flu-like symptoms, they would have sudden deaths. So the scientists, the healthcare workers, all of them started investigating the causative agent or the particular reason behind the deaths, but they could not find a certain or a definite particular reason for the death. So further investigating, they told the world, they told that it would be a flu outbreak. They just assumed that it could be a flu outbreak. So the Chinese government knew that there was a flu outbreak right then on November 2002, but they did not inform WHO or any other country that they had a flu outbreak until February 2003. So by that time, the travelers who traveled to China and then went back to their countries, they took this flu along with them. And by the time the world could knew, the flu had already taken a huge, giant form of a outbreak or a pandemic. So by the time WHO came to know about it, over 500 deaths and 2,000 cases had already occurred worldwide. Okay, so then Chinese government officials apologized to WHO and to the country, but then it was of no use because this had already spread all over the globe. So how was the virus identified? Uh, till 2003, they could not identify a particular causative agent for that flu. But when an American businessman who had visited China and he was going back to his country, America, on the flight back, he fell ill. He was, started showing flu-like symptoms. So the WHO, CDC, and the Canada's National Microbiology Laboratory rushed him to their center and examined him, took samples from his body, and then they found out that it was from the coronavirus family. So they named it as SARS related coronavirus or SARS coronavirus 1, that is SARS CoV 1. Also, they named the disease as severe acute respiratory syndrome, that is SARS, or sudden acute respiratory syndrome. So now once they identified that the virus was SARS-CoV-1, now they had to find the origin of this so that they could stop the virus from spreading. So the researchers, the scientists, and the medical officials, they went back to the Chinese region where the first flu outbreak was seen. They started investigating the wild animals because they had suspected that the virus would have originated from there, because Chinese people, they usually tend to eat wild animals raw without cooking. So when they investigated by viral tracing, they found out that this virus was seen in cave dwelling horseshoe bats. Now these bats are consumed uncooked also, and in a cooked form, that is a bat soup is a delicacy in South China basically. So maybe while handling the bat, while selling the bat, the chef or the shopkeeper may have come in contact with the virus, or any consumer may have may have consumed the uncooked bat. So that may be the reason of the spread of the virus from bats to humans. Also, the bat feces, this particular bat feces, are considered to be medicinal, and so they are consumed. The feces are directly consumed by the Chinese people as a traditional Chinese medicine, which is they consider to cure many diseases. That may be a major transmission source from the bats to humans. So common coronaviruses are basically grouped as alpha, beta, gamma, and delta, but the most common are alpha and beta coronaviruses. Other human coronaviruses which we are well versed with is the MERS, which is Middle East Respiratory Syndrome, the SARS, which we are currently studying, and the new cousin of SARS, that is the novel coronavirus, that is SARS-CoV-2. Now let's take a look at the causative agent, that is SARS-CoV. So it is an single-stranded RNA genomed virus which is enveloped, and it has spike proteins. Now these spike proteins help this virus to enter the cell. We'll know exactly how these spike proteins help it, but these spike proteins are very important for the virulence. So here's a microscopic image of the virus as to how this virus looks under microscope. The symptoms of SARS are basically flu-like symptoms, which include fever, headache, pneumonia, vomiting, chills, malaise, joint pains, and diarrhea. But most distinguishing features apart from flu-like symptoms will be shortness of breath, dry cough, and pneumonia. Now we'll see the mechanism underlying the disease. So this virus enters humans through openings like nose, eyes, or mouth. Once this virus enters the human body, it will try to find epithelial cells. Now, why only epithelial cells? Because this virus, these spike proteins which I told you earlier, these spike proteins bind with ACE2 receptors which are present on epithelial cells. Now these ACE2 receptors are angiotensin converting enzyme 2. Now the normal function of this particular receptor in human body is to control blood pressure, control sugar levels in the blood, and to control immunogenic responses and inflammatory responses. Now here, when this particular virus spike protein binds with the ACE2 receptor, there is fusion of these viral cell with the human cell, and the genome is successfully entered into the cell, and it establishes into the cell, and then it tries to spread. So once this attachment happens, ACE2 receptors and the spike proteins, then the virus will enter the genome and start replicating. Mostly epithelial cells are present in the lungs. So the organism, the virus, first tends to attack the lungs, and it makes the lungs as coronavirus factories. So it starts producing viruses in huge amount. So now that causes alveolar damage, that causes to shortness of breath and dry cough. Then it will try to spread throughout the body wherever it will get epithelial cells. So it damages the epithelial cells of the kidney also, and also it is seen that it can damage the brain cells also. Brain cells do not have ACE2 receptors directly, but they have ACE2 angiotensin 2 receptors, which are slightly different, but then the virus binds to the brain cells also and can cause brain damage. So basically the virus will try to spread all over the body and try to infect all the cells of our body. The mode of transmission, as I said, that the basic origin is the bat. So bat is considered as a reservoir of viruses. Bat has many viruses, not just coronavirus, but many viruses inside it, and from bats it can be transmitted into intermediate hosts. Now it is necessary that the intermediate hosts also should have ACE2 receptors on them. If the host lacks ACE2 receptors, the coronavirus cannot infect that particular host. So that intermediate host can be a pangolin or can be any animal, as I said, which has ACE2 receptor. If it comes in direct contact with humans like zookeepers or forest rangers, so that particular human can be infected with coronavirus. Or as we saw in South China, that they directly consume the bat, or while handling the bat, it can be transmitted directly to humans. Then by human to human contact, that is by droplet transmission, when the infected person will cough or they will sneeze, the virus will directly get transmitted into the other healthy person and will infect that person too. Another way of transmission may be indirect, that is by fomites. So, if an infected person is touching any non living thing and then a healthy person is touching the non living thing which is infected by the virus, then the healthy person will get infected. And also, one major cause is airways, that is by flights, that is international traveling. So, from China, this worldwide spread was basically due to international travelers. Prevention. Now we hear that personal hygiene is the best prevention method for any coronavirus. So washing your hands frequently with soaps or sanitizer, then covering while coughing or sneezing, avoid going in crowds, wearing masks while you go, canceling your traveling plans, sanitize the things especially you buy from outside. And if you're feeling that you're getting symptoms of coronavirus, then stay at home and consult your doctor. There is no treatment for SARS coronavirus strain 1 also yet, but there are some antiviral drugs given. There are some steroids given so that the patient could feel energetic, and plasma therapy, as you are well versed of, plasma therapy was used at that time also. Recent advancements. As of now, we don't have a vaccine, but vaccines are undergoing clinical trials right from 2003. So they are trying to make a whole virus vaccine using vero cells. Now, vero cell lines are the cell lines of the monkey epithelial kidney cells. As I told you, they have ACE2 receptors, epithelial cells of the kidney. That's why they use these kidney cells for the virus reproduction and cultivation. For inactivation of the virus, they are using formalin and UV ultraviolet light. Double deactivation is done just to make it sure that the virus is fully inactivated, and aluminium hydroxide is used as an adjuvant to increase the immunogenicity of the vaccine. Again, we can see that the affinity, there is a recent research done where the scientists have observed that the affinity towards ACE2 receptor 1 is more, affinity of SARS-CoV-2 is more towards ACE2 receptors than COVID-1. So the receptor for both the coronavirus is same, that is ACE2 receptor, but the affinity of coronavirus like SARS-CoV-2 is more than SARS-CoV-1. Also, researchers have found out that smokers, people having diabetes, high blood pressure, and heart diseases tend to show more number of ACE2 receptors on their epithelial cells, hence making them more vulnerable for getting or contracting coronavirus SARS 1. Because more the ACE2 receptors on the epithelial cell, more will the virus get receptors for division, and more is the threat of spreading the infection inside the human cell. So also work is done where we are making drugs which can inhibit this binding of the virus to the ACE2 receptors. So there is a drug which is N2-aminoethylene 1 arizidine ethylamine. So this particular drug, what it does, it stops the binding of the virus to bind to the ACE2 receptors. If this binding is stopped, then the virus will not be able to enter the human cell, and hence there will be no infection and the disease will not take place inside the healthy human. Okay, now there we saw that there was a mysterious disappearance of SARS-CoV-1. So from 2002 to approximately 2005, we saw that there were cases. So it was spread in China, Hong Kong, Canada, India. There were 3 cases, 3 deaths. Not much was seen in India, but throughout the globe, this SARS-CoV-1 was prevalent, and out of nowhere, this SARS-CoV-1 disappeared. So many scientists found many thing or explanations to give this reason why this there was a mysterious disappearance. They found out that there was 70% similarity between SARS-CoV-1 and COVID-2, Also, they found out that the transmissibility is higher in SARS-CoV-1, that is, transmission rate from human to human is higher in SARS-CoV-2. So this may be the reason that when WHO got to know about this and they implemented strict actions like airport screening and all, there was less transmissibility, and then nobody transmitted this disease. This is just an explanation given by scientists. But then again, there are no certain statements or no proofs which can confirm this studies. Also, some scientists said that due to herd immunity it may be possible, but when we see that there were no much cases, like around 8,000 cases, so the explanation of herd immunity was also cancelled. So it is still a mystery for many of the scientists that how this SARS-CoV-1 disappeared. And also Oxford University, WHO and CDC have come to a conclusion like just the way SARS-CoV-1 disappeared mysteriously, it may happen that SARS-CoV-2 also can disappear mysteriously again. Thank you.
Thank you, Shruti. It
Yes,
was very well explained presentation. There
thank
are two questions for you.
yes, ma'am.
So Harsh is asking, why are bats susceptible to this virus for transmission and not other primates or non-primates?
Yes, ma'am. As I told you, bats are reservoirs of many viruses. Now, actually, scientists are finding out uh, what makes bats a reservoir of viruses. We actually don't know why, from where did this virus come in bats also, but we only know that it is transmitted. The origin is bats as of now.
Okay. Then Ruchita ma'am is asking, what diagnostic methods are available for detection?
Yes, ma'am. Earlier, then they used to cultivate this in the cell cultures, in the Vero cell lines, as I told, and they used to take samples from the patients. They used to cultivate and see whether the virus was present or not, or they used to do PCR techniques for confirmation.
Okay. Then Akhila is asking, why number of ACE2 receptor is present more in smokers or diabetes patients?
Yes, ma'am. That is also under research. Why does this phenomena happen? But it is observed by various scientists that this is.
It's already 6:15.
Okay, so our next presenter is Prachi Bhanushali from MSc Biotechnology, and she will be talking about COVID-19. Prachi, are you there?
Ma'am, can you see my slide?
No, dear, not yet.
Hello. Okay. Can you see it now?
Yes, yes.
Hello, my name is Prachi Bhanushali. I'm from MSc Biotechnology from Patkar-Varde College, and I'll be speaking on the topic of COVID-19, the pandemic due to which we are sitting at home right now. COVID-19 is a short form for coronavirus disease 2019. This is the year the first case was reported in China. This This is a respiratory illness with normal symptoms including cough, fever, difficulty in breathing, and pneumonia in severe cases. It spreads via respiratory droplets when a person sneezes or coughs. This virus is an evolved virus which broke out an epidemic due to an open live animal market in Yunnan of Wuhan, China. Thus, this is a type of a zoonotic disease and occurred due to the host switching. So the history for this virus is in 2002 and 2003, a SARS-CoV cause an epidemic with a mortality rate of 10% within China. Further, this virus was seen with a similar symptoms in the Middle East region, and that's why it was named as Middle East respiratory syndrome coronavirus. This had a mortality rate of 3% worldwide. COVID has about 79.5% of its genome and structure similar to 2002-2003 SARS coronavirus. That's why it is named as severe acute respiratory coronavirus 2 because it has similarity to the 2002 coronavirus. Here, in all these three viruses that had outbreak, bat was found as to be the reservoir for the virus. This virus was indirectly or directly spread to humans. Indirectly, it spread via an intermediate species uh, of uh, of animals, which included in SARS it was civet cats, in MERS it was MERS-CoV it was camels, and for COVID-19 it is said that it could be pangolin. So the causative agent for this virus is SARS coronavirus 2 virus. The family that it belongs to is Coronaviridae, and the subtype or the subfamily this virus belongs to is Beta Corona SARS type. The genome that it has or it contains is single-stranded RNA strand, which is of plus sense. So this plus sense indicates that it can mimic the action of mRNA present in the host that it infects. It is an enveloped virus which contains three main proteins, that is hemagglutinin, neuraminidase, and spike protein. So hemagglutinin has 18 serotypes and neuraminidase has 11 serotypes. The spike protein is the reason, as Shruti said earlier, for the pathogenicity as it binds to the ACE2 receptors present in the host cell that it infects. This virus has two major subtypes, that is L and S type. So this is basically a strain in which L strain is the one that is causing the pathogenicity seen right now. The signs and symptoms of this virus, as you all have heard, is that uh, it is caused due to human transmission and direct contact. The symptoms include fever, tiredness, dry cough, body aches, nasal congestion, runny nose, sore throat, and diarrhea. This symptom starts from 5 to 6 days after exposure, and the symptoms can occur also after 14 days of exposure. That's why a 14-day isolation period is given to us for the symptoms to occur. Some individuals are asymptomatic, which are actually the main cause this disease is spreading, as they do not know and they unknowingly spread this disease. They are termed as the carrier for the disease. Approximately 80% of the people who have infected are can recover from this disease as calculations are carried out. Of all the infected people, only one of the six people who gets severely ill and has difficulty in breathing. The transmission of this disease is due to the respiratory droplet when a person sneezes or coughs. These droplets can remain in the air for a few hours, but it cannot travel distances. Therefore, it is not an airborne disease. Therefore, person should wear masks necessary when they are going out. It also spreads via human to human contact. Therefore, maintaining distance is very important. It can spread via fomites. Basically, fomites are substances or non-living objects when a sick person touches them. If a healthy person touches this substances, it can get transmitted. Asymptomatic people play a crucial role in the transmission as they are the carrier for the disease. Mode of transmission of this disease starts with the bat. Basically, and bat which is already infected via a virus, it when the meat of this virus comes in contact, for the instance in Wuhan, China, the live market, the meat was exposed to a human. or it can indirectly get transmitted when a excretory droplet of this bat comes in contact with the pangolin, which is the intermediate species, which could be the intermediate species, as this virus tend to switch host due to antigenic shift and antigenic drift seen in them. This occurs for the virus, so that virus survives. It basically switches host. Antigenic shift occurs when two or more viruses combine together to form a novel subtype of a virus, and antigenic drift occurs when accumulation of mutation occurs in a specific virus. This both is the reason why host switching is seen, and here in COVID-19, the reservoir or the source of virus is bat, while for SARS it was CIF cat, and for COVID right now it is researchers are thinking that the intermediate species is pangolin. So how can you prevent this disease? So prevention, everyone is hearing this since 3 months, that we have to maintain a social distance, you have to wash your hands, maintain personal hygiene. Personal hygiene right now is very important. You should use hand sanitizers whenever you are outside, so that you can avoid fomites transmission. Cover your coughs and sneezes whenever I use masks, and disinfectant surfaces which are oftenly touched. Avoid being in crowds and in gatherings, and also only seek information from reasonable sources like CDC and WHO. Don't come across fake news or that are spread across WhatsApp, and that's why you should stay away from WhatsApp University. So the detection of this disease right now can be carried out in two methods. One is RT-PCR, that is reverse transcription polymerase chain reaction, in which a nasal or a throat swab is taken, as the viral load in huge amount is seen in the throat or the nasal because of the epithelial cells are more in this region, and this is then taken to a laboratory, and this being a RNA viral genome, it is a single stranded RNA, so it is converted into a cDNA or a DNA molecule with the help of reverse transcriptase enzyme, and PCR is run with the help of fluorescent dyes. If the peak observed in uh, this is the fluorescence that is seen. If this peak, there's a peak and it crosses the control baseline, that means the person has the antigen uh, present in the sample, so the person is corona positive. But if the person has fluorescence under the baseline, or there is no peak seen, that means the person is corona negative, so he does not have the antigen present in the sample. The another test that a person can do is antibody test or serological test, in which the blood sample of the person is taken and its IgM and IgG antibodies are checked. After this, the sample is reacted with antibody linked enzyme. Basically, an ELISA kind of test is done, in which if the substrate, the antigen of the sample and the antibody linked enzyme is added, and if a coloration or color change is seen in the titer, that means the person has coronavirus. But if there is no color change in the titer, that means the person does not have the antigen for the corona and he is corona negative. Treatment, there is no specific treatment involved for this disease, as it uh, just has arrived right now. So everything is based on symptom management. Only medications according to your symptom has been given, in which if a person is suffering from fever or throat sore, azithromycin and oseltamivir is given. It is a type of a Tamiflu, uh, just in case to build an immunity of a person, because the person's immunity in this condition is very weakened. Another medicine like ivermectin and doxycycline is given if a person shows condition leading to difficulty in breathing. Clinical trials for an vaccine have started across the world. Basically, it's an RNA vaccine, RNA virus. So, mRNA-based SARS-CoV-2 vaccines are currently underway, and for this, the vaccine that are designed are with a methodology of 2 doses, in which will be given 28 days apart, just to maintain the safety and immunogenicity of the vaccine. Current research that is being seen, some treatment or medicines have been administered into patients, uh, which showed recovery in patients. So this first one is remdesivir. This is a failed vaccine for Ebola virus, which actually helps to stop the replication of coronavirus, which showed some recovery and positive signs. So US has approved 5 clinical trials on it right now. The second one is antiviral EIDD 2801. This also induces mutation in the RNA, therefore inhibiting its replication, and the human trial on this has already begun. Another one is Japan flu drug, which includes favipiravir and avigan components. This also stops replication of virus and also has shown improvement in lung condition for some cases in the US. Another known drug that is chloroquine and hydroxychloroquine. This has showed some impact on SARS-CoV-2 and clinical trials have begun. Currently, 6 Indian companies are working on for a vaccine against coronavirus. Nearly 70 vaccine candidates have been administered and have started their testing, from which 3 have moved on to human clinical trial stage. Australia's national agency CSIRO announced earlier that it has begun its preclinical trial test of vaccine developed by Oxford University in the UK. The WHO has listed Zydus Cadila and Serum Institute from India as among the global firms working on COVID-19 vaccine. The vaccine name that they have given is Zyd-CoV-D. Another one is from Bangalore, India, called Bharat Biotech, which has got approval for human trials for a vaccine called as Covaxin. This is the news of today that has been reported that these vaccines are going to mark as the beginning of the end of the coronavirus pandemic, affecting more than 12 million people over the world, and it is going to be available by 2021, as 15 months trials are required for a vaccine to be properly tested. Like this, more 15 leading pharma companies all over India has started clinical trials for COVID vaccine. So these are my references. Thank you. Maintain social distancing and wear masks. Any questions?
Thank you, Prachi. It was very nicely presented. You have one question from Harsh. If the transmission was taking place in wet markets or by slaughtering animals and eating, why doesn't the spread of virus happen way long ago?
Mm, I have no idea why it outbroke now, but there's
Okay, I would like to answer this. This is actually from the family of SARS, and SARS is in human population for generations and generations. As they are RNA viruses, they are getting mutated and getting hybrid, and that's why there are outbreaks of newly hybrid viruses every now and then. So I think I have answered to the first question. I thank you, Prachi. There are no more questions for you. I will call upon Sagarika again to present on MERS-CoV.
Hello, ma'am.
Yes, yes, you're audible to us.
Uh, yes. Could you please just put up my presentation?
Yes, yes.
Okay.
Yes, Sagarika, you can start. Sagarika?
Hello. Yes, ma'am. Can you hear
Yes,
me
yes.
now?
Yes, yes, dear. Please start.
I'm so sorry for all the technical glitches here. I'm so sorry. It's raining outside, so I cannot manage it right now. Am I audible now?
Yes, yes.
Yes. So, hello, good evening, everyone. So, this is Sagarika Behra, and you all know we are here speaking on zoonotic transmissions and disease. So, I am here with one that is Middle East Respiratory Syndrome, a type of coronavirus. It is it is a this is basically caused by coronavirus. Coronavirus, a large family of viruses which range diseases from common cold to severe respiratory syndrome. It is a kind or a type of a zoonotic transmission out of two, that is MERS, which is Middle East Respiratory Syndrome, and SARS-CoV, which is severe acute respiratory syndrome. It is a respiratory syndrome, and its name, that is Middle East, has its name as Middle East due to its origin in the Middle East, that is Saudi Arabia. As it affects human, bats, and camels, the main reservoir of this syndrome is camel, and hence it is also known as camel flu. This virus belongs to the genus beta coronavirus. Out of two human coronavirus, that is alpha and beta, MERS is subclassified in beta coronavirus, and it is subgenus as Merbecovirus. So, the origin of this virus. The first identified case was seen in the year 2012 in Saudi Arabia. Uh, uh, Egyptian virology expert, that is Ali Zaki, isolated, studied, and found that isolated cell gave the cytopathic effects. The second case was just in the same year, in September, and patient under study was found to have similar flu symptoms as the first reported case. Since then, in November 2012 itself, there was an outbreak of MERS in 27 other countries. Here are the list of some countries where the MERS had an outbreak. 80% of total reported cases were found in Saudi Arabia, and 35% of reported patients have died. So here in the structure you can see it is a beta coronavirus, we all know, and human coronavirus are broadly classified into two types, that is alpha and beta. And here is the structure of beta coronavirus, that is MERS-CoV. It has four major proteins which helps virus to enter the cells, that is envelope protein, spike protein, nucleocapsid, and membrane. This infecting virus has single-stranded RNA structure. This structure of virus also consists of two large polyproteins, that is polyprotein A1 and polyprotein 1AB. These polyproteins are broken by proteases to form some non-essential enzymes. So next we'll discuss about the role of each proteins and the functions. The first is the spike protein. It is a transmembrane glycoprotein which has S1 and S2 units. Basically here S1 is responsible for binding and S2 is responsible for the fusion. So V host has the DPP4 receptor, which is also known as dipeptyl peptidase receptor. So this S1 with the receptor binding domain binds, and the S2, after the S1 binds, the S2 has which contains heptide repeats, forms the fusion which is which is responsible for the entry of virus. The next is the envelope virus, which has role in the viral assembly and give the intracellular structure or the support to the virus. The membrane protein has role in viral morphogenesis, replication, and also assembly. The nucleocapsid protein, including all other protein, that is spike, envelope, and membrane, interact to form a complete virus particle. So next is the transmission of the virus. The major reservoir of this virus are bat and Omani camels. Camels being a huge source of Middle East economy for their daily livelihood. Camels are the reason for the transmission of virus to human. So transmission of MERS can be of two types, that is non-human to human and also human to human transmission. In non-human to human, it is a direct or primary form of transmission which are occurred or transmitted by the bats or Omani camels. Also dromedary camels. Dromedary camels are the racing or traveling camels which are used by the Middle East people, and it is a source of economy for them. So there are basically the direct form where the infected camels or infected or sick animals infect the humans. So next type, which is that is human to human transmission. This is direct contact, or it is formed through fomites. You all know what fomites are. It is direct contact or through fomites or physical contacts, and also poor practice of personal hygiene. So avoiding close contacts can render this transmission human to human transmission. And also it is a secondary form of transmission, as a sick patient or an infected patient can transmit it, and not the reservoir of the virus. Next slide will yeah Next slide, you can see non-human to human transmission, where the transmission can occur through airborne contacts or through ingestion. Ingestion is the raw eating of raw meats or having raw milk of camels who are sick basically. Or airborne contacts includes the taking out milk from the animal, or close contact with them, or through the droplets of their nasal droplets, or anything. So here it is an overall non-human to human transmission which can occur through ingestion, that is direct intake of the meat or milk, or through indirect, that is the touching of animals who are sick or coming in close contact with them. So next slide will show the transmission cycle, where humans are also infected through various fields. That is, it can get infected through camels, directly can get infected through bats, or aerosols, or inhalation. So eye rubbing, or touching your nose, touching your face can also cause the transmission of disease into you, transmission of this virus into you. It is a human to human transmission, includes directly from an infected patient. And in this slide you can see it is an overall transmission, overall cycle from bats to camels to human, which are caused through ingestion, direct intake of the food materials of sick animals or infected animals, or through aerosols or through the dusts. So now if one is infected, so what are the clinical symptoms one can get? So some laboratory confirmed cases reported that most of the MERS coronavirus are asymptomatic, that is, there are no basic symptoms to it, but there are still symptom which ranges from no symptoms to severe cases, and also death sometime. So typical symptoms include fever, cough, shortness of breath, as it is a respiratory syndrome. The incubation period is 5 to 10 days. Apart from the common respiratory symptoms, there are abdominal pain and diarrhea. It can have gastrointestinal symptoms as well. Also, we all know virus affects the immune system, so immunocompromised individuals are more prone to this virus. If it is not treated properly, the patient can have renal failures or multiple dysfunction and other syndromes as well. So next slide will be the representation of what all symptoms one can have. So we know fever, cough are the basic symptoms or typical symptoms, whereas the renal failure and pneumonia are some cases which are not confirmatory, of course, but also can occur as symptoms. So uh, once you are detected with symptoms of such virus, so what are the diagnostic techniques which can be used? So molecular tests which are used to diagnose this infection in people who are detected with clinical symptoms and to places where MERS has been reported. That is, all the person who are infected are diagnosed with are diagnosed with molecular test and also serological test sometimes. But molecular tests like RT-PCR is uh, one of the diagnostic ways to find if the person is infected or not. So this real-time reverse transcriptase PCR assay can be used to detect the viral RNA in our clinical samples. What all samples are required? It can be lower respiratory tract specimens or it can be upper tract specimens. Lower includes sputum and tracheal things, and whereas the upper includes bronchiolitis, bronchoalveolar lavage, and other nasal swabs. So the success rate depends on also the success rate of PCR depends on the experience of and the expertise of the lab personnel and the types of specimens. Patient is considered as negative for this virus when two consecutive tests, that is two consecutive PCR tests, should be negative to consider the patient is negative from this from this MERS virus. So there are three basic advanced assays which are currently available for diagnosis. These are the three, that is through assay targeting upstream of the E protein and open reading frame A and B, which this advanced techniques are very much are not much available or not much spoken about in India, and there are information was quite not available for all this, but the basic and major diagnostic techniques used is RT-PCR. So the next is prevention and treatment. We are all well versed with the prevention and preventive measures to be taken as we are all in this pandemic. So general hygiene is washing your hands regularly, as it is related to camels. So touching animals and then not have washing your hands is an unhygienic practice. So regular washing your hands before and after touching animals, also avoiding direct contacts with sick animals as well as the infected humans. Use of mask and covering your face is must. Consumption of this raw milk or undercooked meat should be prohibitory because it can infect you with MERS virus. Pasteurized food, if food is pasteurized, it should be kept away from the unpasteurized or unhygienic food to to avoid cross contamination. For treatment, there is no such vaccine available, and clinical trials is still going on, and vaccine studies are going on. Recombinant MERS covirus spike nanoparticle vaccine, which is under a clinical trial still. It has been years, it has been 8 years, but still it is still under clinical trial. For treatment, supportive care, oxygenation and ventilation should be provided. So here is a slide of preventive measures. If there is a fever or rise in temperature, one should consult a doctor. Washing your hands is must. Avoiding hugs and direct contacts with infected or maintaining social distancing is much needed. And also covering your face while sneezing or coughing is a preventive measure. So healthcare facilities, we need to speak about this healthcare provider workers and facilitators, because we have been watching news on this, how they are harassed and how they are fighting for their own self-respect, where they are doing so much for us, and still they are getting affected very bad. For the prevention and control measure, it is very much critical for them to protect themselves from coronavirus. So transmission of this virus to them, that is healthcare workers, can be transmitted through patients. This healthcare worker should take appropriate measure to decrease the risk of transmission from the infected patients. So this they do wear PPE equipments, which reduce the direct exposure with the patients. PPP unit includes helmet, gloves. As in the image, you can see it consists of goggles, boots, surgical gloves, apron, mask, and all. Also there should be a they should be properly educated with and trained with this period, with this pandemic period, or with the should be regularly refresh their skills on this on this healthcare stream, so that they can be effective, so that they can be effectively helped. So all of us all of us has some roles into it. We as an individual are taking so much of precaution, staying at home, maintaining all social distancing. There are organizations who are doing much more than that. There are that is WHO, World Health Organization, which is an international organization which is working with doctors, scientists, and specialists for public health. WHO, in collaboration with Food Agriculture Organization and also national governments, to develop public awareness and develop public health prevention strategies. They are also coordinating with global health by conducting awareness about this all virus infections. Also, they are giving training to the health providers, health authorities. WHO keeps all its data refreshed and provide all the accurate information to the member states. And also, it periodically takes or asks member states to report the confirmed cases or the number of cases which has been there, or also ask for the availability of sources if there is proper availability of sources. So it's then end of presentation, where here are the references. So maintain social distancing, and please do listen what government says and have patience, all of you. Thank you so much.
Thank you, Sagarika. You have no questions over here. It was nice.
I know, ma'am.
And well explained.
Thank you so much, ma'am.
So here we continue with what was today's session conducted as. So how do microbes spread between animals and people, that you have seen today, and it has well nicely presented by the MSc students. The most common ways is direct, indirect, vector-borne, foodborne, or waterborne. And these things have been nicely presented by the MSc students, so I'm not going to go in detail with this. Then talking about higher risk of illness, as they have explained earlier, the higher risk of illness is to the children younger than age of 5, adults older than 65, people with weakened immune system, and also the pregnant women. So the preventive or protective measures that are to be taken is keep hands clean, washing hands right after being around animals, even if you don't touch any animals, is one of the most important steps you can take to avoid getting sick and spreading infection to others. Then know the simple things you can do to stay safe around your pets. Now, what does we mean by simple things you can do? like washing hands, choose right pets, like don't go for exotic pets, don't kiss, snuggle or hold rodents, reptiles, amphibians, poultry, and such kind of animals. Then supervise small children's around pets, keep pet supplies out of your kitchen, clean up around pets, then avoid rough play with animals, clean bites and scratches immediately if you have one while playing, and enjoy wildlife from safe distance. Don't go and pet wildlife animals, please. Then prevent bites from mosquitoes, ticks, and fleas. Learn more about ways to handle food. Then beware of zoonotic diseases, both at home, away from home. Like if you're visiting zoos and petting the animals in zoos, please don't do that. Then you take care about childcare settings as well. When you travel outside, don't pet stray dogs or stray cats when you are traveling outside. Then avoid bites and scratches from animals. So these are few simple preventive measures that we can follow to prevent ourselves from any emerging or re-emerging zoonotic diseases right now and also in future. So now the time has come to wrap up this event. I would like to thank our coordinator, Ms. Ruchita Rane, for organizing this wonderful event. I would also like to thank our MSc students for putting their great effort and enlightening us with detailed information on zoonotic diseases. Benjamin Franklin has well said, an ounce of prevention is worth a pound of cure. So there were so many things to be gained from this awareness drive, and I'm sure each one of you will look forward to it. I wish you all good health and fitness. Take care, stay home, stay safe. Thank you. The feedback form the link for feedback form will be provided to you very soon after the after this. Thank you all. Participants, you can leave the meeting. मॅम हॅलो हॅलो हां मॅम मॅम हे सेव्ह कसं करायचं म्हणजे आता ते रेकॉर्डिंग ओके ओके आणि मग एंड करू ना डायरेक्ट मग आपोआप सेव्ह होणार का ते